Hello.
Hi.
Hi. My name's Jake. I'm going to be taking care of you here today. What's your name?
Nice to meet you. My name's Adam.
Hi, nice to meet you. What brings you into the clinic today?
Man, I don't know. I just have this pain in my stomach that it seems like it's hit or miss, and it's just been really bugging me.
Okay. When did this start?
Gosh, probably like off and on. It seems like every time I eat the last like month or two.
Okay. And is it just in that upper part of your stomach, or does it go anywhere else?
It's up in like the middle of my stomach. I don't even know what you call it, like here.
Sure.
And then it seems like it goes off to like this left side. My like whole kind of left side area hurts.
And how long did you say this has been going on for?
Probably a month or two, probably 2 months.
Okay. Okay. What does the pain feel like? Is it like sharp? Is it dull? Is it aching, cramping?
It seems like it starts off dull and then it's like a shooting pain.
Shooting pain. Okay. What makes this worse? Does anything make this worse or better?
I feel like every time I eat, it hurts. I noticed like I went to the movie theaters and popcorn made it really bad.
Okay.
I was trying to kind of figure out if it was like a certain type of food, but
Sure.
mostly everything's bugging it.
Okay. Is anything making it better? Have you tried anything to make it better?
I've been taking the stuff my wife gives me to help like stop me from being have diarrhea so much.
She is like Imodium.
That sounds right. Yeah. Yep. Yeah. It's over the counter right now.
Does that help? Does it make the pain worse?
It didn't really do much other than kind of clog me up, I feel like. But
Okay.
yeah.
Okay.
I'm a mess.
Yeah.
Doc.
No, that's okay. We'll see how to get you figured out here today. Okay. So you've gone over making it better. Anything that made it worse. And then do the symptoms last for a long period of time, or do they like kind of subside and get better and then relapse again, or happen again?
It seems like an hour after I eat, it'll come on, and then it'll stay there for a couple hours. It'll hurt.
Okay. Okay. How's this like affecting your life? Are you able to go to work? Are you able to do things you like to do? I guess
I just feel like it's noticeable that I'm going to the bathroom more, and
Sure.
I'm having a lot of flatulence, which is no fun to
Yeah.
be around, and
It's gonna be frustrating.
Just that side always hurts. So I feel like even when I'm playing or doing something, that is kind of hurting.
Okay. And then, so that's all the questions I have about that for now, but then just to kind of get into some of your background, do you have any medical problems in the past?
I haven't been diagnosed with anything.
Okay, you don't take any medications?
Nope. I take creatine for the gym gains.
Okay,
And that's the
sounds
only
good.
supplement I take.
Okay, wonderful.
Yeah.
Any allergies for you?
Sulfa-based drugs, I was told when I was young.
Okay.
I had a reaction, not really even sure.
Okay, perfect. Any family history of any abdominal problems or just problems in general?
My mom has hyperthyroidism, I think it's called, like an overactive thyroid. Other than that, though, my dad doesn't have anything.
Okay, good. And then do you drink alcohol?
Occasionally, yeah.
Okay.
Probably like once a week, maybe
Okay.
three drinks. I'm not sure.
3 drinks a week, you say? Okay. And then any tobacco products?
No.
No. Any drug use?
Not for a long time.
Okay.
I used to have an issue with like marijuana, but I don't use that anymore.
Perfect. That's okay. All right. Do you have any questions for me so far?
No.
No? Okay. Well, I am just going to have you take your shirt off, and we're going to
Sure.
start looking at a couple of things here. Okay, and just sit nice and straight for me. Just going to take a peek here. Any past surgeries, anything like that?
No.
No? Okay.
Oh, I had my tonsils removed, I guess. when I was
Tonsils,
young.
nothing in the belly, appendix, gallbladders, all
nothing
the
here.
parts are in there.
Should have all of them.
Perfect. Okay, so I'm just looking here. Everything looks very uniform. No signs of obvious masses, no signs of obvious lesions. You do have some unilateral hair growth over here. That's been that way all your life, pretty much?
Yeah, I've had that forever.
Okay, sounds good. No recent trauma to the stomach, anything like that? Haven't been hit or fallen, nothing like that? Okay.
No.
No signs of bruising, ecchymosis. Everything looks symmetrical and sound. So we're going to kind of move here. Go ahead and have you lean back on the exam table here.
Yep.
Okay, so next thing we're going to do is I'm just going to kind of, this might seem a little silly, we're going to tap around on your belly here. I'm basically just going to kind of look at your liver. I am going to make a couple marks. This should just come off in the shower here.
Okay.
Measuring your liver, taking a look at your spleen, and then we'll move on. But if you have any pain, discomfort, let me know.
Okay.
All right, so we're just gonna start with your bowel quadrants.
Okay. It's a little tender in there.
Down here?
Yeah,
Okay.
kind of that. The farther you down, yeah.
Okay.
In there.
Even with the light tapping, that's kind of tender. Okay.
Yeah.
So we'll stop there then. But I did get all that. Everything sounded good. Good timpani throughout the bowels. And that's kind of what we like to hear there.
Okay.
So
Okay.
just gonna look here. I'm gonna start finding that area of dullness. Just about right there. I'm just gonna mark here. Try not to get pen all over your pants here.
Oh, yeah, thanks. Well, it's cool. You can tell what's going on in there.
Yeah, no, it's helps us to measure for any like enlargement of the liver here, and I have a slight change in sound in there, so I'm gonna mark that there. And I'm just gonna take a quick measurement. And it's right at about 7 centimeters, which is perfect for a guy your age. So
awesome.
That's wonderful. Know that said this was a little tender. I am just gonna kind of percuss over here for your spleen.
Yeah, it's not like excruciating pain or anything. I can just feel it there.
Percussing for some dullness here over the splenic area, just to Any tenderness in here when I'm pressing? Let's look out over the ribs.
No.
Oh, okay, perfect. So liver looks good. Percussion was good. Timpani found throughout all of the fields. Okay, I'm gonna have you just sit up here for just a second.
Sure.
I am just gonna kind of tap down here on the back. Let me know
Sure.
if you have any tenderness back here, okay?
Okay.
Any tenderness, just checking for any tenderness in the kidneys?
No.
Nothing? Okay. Nothing?
No,
Okay,
feels good.
wonderful. Have you had any like nausea and vomiting with this at all?
No, not really. Just a lot of the diarrhea.
Okay.
Yeah.
Okay.
And the flatulence.
All right, perfect. Next thing we're gonna do is we're going to palpate. So when we get to the left lower quadrant, we know it's a little tender already. I'm not gonna go super deep there. Just let me know if it's too much.
Okay.
But I am just gonna see if we can feel any masses, any changes like that, okay?
Okay.
Okay, so I'll just have you lean back again really
Okay.
quick. So we're just gonna start with some light palpation here. In the right lower quadrant, no mass is palpable. Moving up to the right upper quadrant, no mass is palpable. Moving over to the left, I know he's got some tenderness here, so I'm just being gentle. No, nothing felt. And right into the left. And I just want to ask you a quick question. Does it get worse when I push in or when I let go?
Oh gosh. Probably when you push in there.
When I push in there, okay. All right, we're gonna move to some deeper palpation here, okay? Over on this, starting over here, we know that's less tender for you. Nothing felt on deep palpation. You can kind of find the border of the liver there. Okay, no tenderness. Moving over. No tenderness there. Okay, we're gonna go a little deep here. Just let me know if it's too much, okay?
Okay. That's all right. I just kind of pressure that double point.
Sure. You can kind of feel slight palpable mass here in this left lower quadrant. So, okay.
Okay.
All right, now we're just going to take a listen to your stomach here, okay? We'll listen for your bowel sounds. We are going to take a listen to some of your arteries, make sure that we don't hear any bruise, anything like that, okay?
Okay.
Active bowel sounds in the right lower quadrant. Active bowel sound in the right upper quadrant. Slightly hyperactive up here in the left. And got some hyperactivity down here too. Okay, I'm gonna just listen to your aorta here, okay?
Okay.
I don't hear any bruise. I'm gonna switch over to my other side. Listen to your other arteries here. Assessing for any bruise in the aorta, in the iliac arteries. Okay, no bruise observed. Okay, you can go ahead and sit forward for me. And you can go ahead and put on your shirt here as well.
Sure.
So, just a couple of findings that we found. You know, there's that little bit of tenderness in that mass, kind of in that left lower quadrant.
Yep. Okay.
So having that left lower quadrant pain, especially with palpation, is kind of a hallmark sign for us for diverticulitis. So basically what that is over time, and it's usually common in older adults, but it can happen in younger people too. You get this little outpouching in your large intestine. So the mucosa, or the layer of your intestine on the inside, will kind of protrude onto the outside. Those can collect with food, debris, and they can get big and cause an abscess and get kind of painful. So a lot of people have said like things like small food, like nuts, seeds, popcorn can be a huge thing for that. Those smaller things can kind of collect and cause us some problems. So what I'd like to do is just get a baseline set of labs for us. So we'll get your CBC, we'll check out your blood count. So your CBC will have your white blood cell, red blood cell, platelets, kind of some of those things. And then we'll move into your metabolic panel, checking out your electrolytes, just so we have a baseline understanding of your kidneys, your liver, all that good stuff. I do want to check a CRP, which is kind of an acute phase reactant inflammatory marker.
Okay.
We'll take a look at that. And then I do really want to get you for a CT scan.
Okay.
So we can see the severity of this, make sure that there's no free fluid in your abdomen causing any of these issues. And then while we're here, we should probably set you up. We usually don't handle it while it's in the acute phase. We get things resolved, but we need to have you meet with a gastroenterologist to schedule you probably for a colonoscopy to check out the kind of just to confirm the diagnosis of diverticulosis.
Okay.
So you can get diverticulitis after you've had diverticulosis. Diverticulosis is the disease. Diverticulitis is when that gets inflamed.
Oh, okay.
So, and that can help us in an early stage kind of rule out any further malignancy and just kind of get the ball rolling on that. So I think it's really important that you stick to that appointment. But we can help you set that up here and kind of go from there. Do you have any questions for me right now?
No, I don't think so.
Okay.
Appreciate your time.
Okay, perfect. Well, let's get those labs drawn, and then let's see how quick we can get you over to the CT scan, okay?
Sounds good.
Okay, nice to meet you, my friend.
You
We'll be
too.
with you.
Thanks.